The three words I'd use to describe my role is team, rewarding and challenging.
Positive, team, supportive.
Three words I'd use to describe this job: gratifying, inspirational, challenging. Before this, I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time to build a picture through talking with our residents about how they lead their lives, the things that they find difficult, the things that they can do, and also looking at how they wish to fulfil their lives to the best of their possibilities. In the 5 years of working here, I've learnt so much, particularly about social care. I had no previous experience in it, but through a really good training and induction plan, I was given all of the skills and information that I needed to be able to do my job. I've also been able to grow personally and within my career since then through a personally tailored plan of support and training to keep me going.
We're a really close-knit team and we thrive off helping the community of Nottinghamshire to live a valued and independent lifestyle. Every day is different and there's always new things to learn, which makes the role interesting and really exciting. At the end of the day, knowing that I've helped a number of people to have a better quality of life makes every day worthwhile.
Prime Minister's roadmap to recovery holds out the prospect that we can return to so many of the freedoms we've been missing, and that by summer and autumn we could be enjoying for ourselves again, getting together with friends and family. All of us are looking forward to that. But between now and then, we actually have quite a long way to go. And the reason for that is that the rates at the moment in Nottinghamshire County are still running at a very high level. It's really important that we bring those rates much lower. To continue with rates at this level, we risk seeing a resurgence which would threaten our local NHS, and it's imperative that we avoid that. So I'm urging everybody, right from the start of this roadmap as we move into step one, to continue to do all you can to pay attention and to follow all of the rules that are in place in step one. It's really critical that we don't race ahead to a next step without completing this one. To do that would risk the recovery that we're all looking for.
Okay, good morning, everybody, and welcome to the COVID-19 Renewal Committee, which is being held remotely, as you know, and broadcast live. For the benefit of viewers of the live stream, I'm going to ask Joe now, who's the clerk, just to go through a list of the members and officers present today. Joe, if you don't mind.
Thank you, Chairman. In addition to yourself, we've got Councillor Bosniak, Adair, Bradley, Cutts, Garner, Payne and Rhodes, and we're currently getting Councillor Zadrozny connected to the call.
Okay.
And as well as myself today, we've got the following officers present. We have Anthony May, the Chief Executive, the Corporate Director Place, Adrian Smith, the Director of Public Health, Jonathan Gribbin, the Service Director, Derek Higton, and we should hopefully be joined by Matthew Neal too. We're also joined today by Sarah Carter from Nottingham and Nottinghamshire's Clinical Commissioning Group.
Thanks, Joe. Okay, so just on to the main agenda items, and we just go through the bureaucratic ones first. The minutes of the last meeting on the 25th of January. Can somebody accept those as true and accurate record, please? Thank you, Reg. Oh, sorry. Yeah, thank you. Okay, there's no vote needed there. Joe, have we got any apologies?
No apologies today.
Okay. Does anybody have any declaration of interest? I'm not seeing anybody raise any hands, so I'm going to assume that that's none. Thank you very much. On to the COVID-19 situational update then, which is agenda item 4 in your papers. I'm going to hand this over to Jonathan, but I believe that Sarah Carter is also going to add some information for as well. So Jonathan, would you like to kick off, please?
Good morning, councillors. Yes, be happy to do that. Chair, might I just check with you, having Sarah Carter with us as we do, would you like to have an update on, brief update on vaccines first of all, and then I can move on to cover off my bits?
Yeah, I think that would make more sense. Thank you very much. Sarah?
Thank you, Councillor Knight. I've got a brief presentation that I'll share with you, if that's okay.
Yeah, that's fine. Thank you.
Apologies, I'm having some trouble getting the presentation up.
And don't worry about it.
Chair, if it would help, it's Anthony May. Sometimes Sarah has problems sharing her presentation with our system, although it's come up now. Okay, thank you, Sarah.
Oh,
there you go, Sarah. Yeah,
thank you.
Great. Yeah.
You can see. Can you see that? Okay.
Yeah, Anthony was just rushing in with excuses before you'd even finished. So there you go. Thank you very much. You can see that. Everybody can see that.
Thank you. So I'll just give you a bit of a brief update in terms of the fact that the headlines. We've still got 13 sites live across the Nottingham and Nottinghamshire system. I won't go into all of them, but more recently we've had the Village Hotel in Beeston that's been established as a pharmacy-led site, and of course the Towers in Mansfield, that's also a pharmacy-led site. We've got a further 2 new pharmacy sites that went up last week, Beeston Village Hotel and the Riverside Pharmacy in Bulwell, and those sites will provide a really convenient location for residents in the surrounding areas to be vaccinated. The latest vaccination figures released last Thursday show that we're continuing to improve, and I'll go into a little bit more detail, Chair, in a moment, but the latest figures that were released last Thursday but relate to the week ending the 7th of March show that we're making some really excellent progress with our programme. That 376,660 vaccinations have been administered in Nottingham and Nottinghamshire to date. Last week we opened up our booking to all of those who are aged 50 or over, and for those people who aren't aware, that is cohort 8. Apologies, that is cohort 9. And we are urging anybody in those groups who haven't booked to book as soon as possible. In each priority cohort, there's still a small amount of people who've not yet come forward. And again, we would really like to encourage those who've not yet taken up the offer to book in. Health and care teams are working together to make sure people in all communities across the city and the county are getting the vaccine. Over the last few weeks, general practices across the county have been contacting eligible residents to receive their vaccinations at a number of pop-up clinics, and that model will continue to be used in areas of low uptake over the coming weeks. Targeted work is going into homeless communities, those with learning disabilities, pregnant women who are clinically vulnerable, as well as BAME communities. The reduced vaccine supply in the last week, or the previous, actually in the last week, had limited the appointment availability for last week. However, the vaccine supply has now increased and we've adjusted our appointment availability accordingly. The fluctuation in vaccine supply was planned for and factored into the planning of the vaccine rollout, but we are assured that now we've seen reasonably substantial step up of vaccine that we should be able to deliver across the board and increase the number of appointments across our sites. So although this is probably a slightly difficult document to see, what I did want to point out to you was the Nottinghamshire including Bassett law figures, and what you will see now is that Nottinghamshire is more than well aligned with the England average and the Midlands average for pretty much all vaccinations. So in terms of the 16 to 59 cohort, we were at 27.3%. The Midlands average is 22.6. In the 60 to 64s, we're at 76.7%, and the Midlands average is 75.4. Our 65 to 69 cohort, we're at 90.4%, and the Midlands average is again 90.2%. And similarly with the 70 to 74s, Midlands average is 96.4%, and we're at 96.9%. 75 to 79s, we're at 103.6%, with 102% as the Midlands average, and the 97.2% for the over 80s, with the Midlands average at 96.2%. So you can see from that data, Chair, that although we got off to a very slow start in Nottinghamshire, we are moving forward at scale and pace, and have indeed, we believe, redressed the balance. In terms of the next slide that I'll move on to, I know you were interested in what the programme is doing in relation to inequalities, so I thought I'd mention that the inequalities group that's been established as part of the vaccination programme meets on a very regular basis, at least once a week, often twice a week. That's supported by an inequalities cell that's been established as part of the LRF incident response structure. What the inequalities group does is take the population modelling and stratifies and plans for the needs of different population groups. As a result of some of that, we see different activities taking place across the county. So in order to address inequalities particularly, we've commissioned a transport hub to coordinate specialist community transport for at-risk groups to access vaccination services, and that does include 12 volunteer driver schemes in the voluntary and community sector, as well as approved taxi providers. Just to reassure everybody on the call, this is individual transport, not shared transport. We've mobilised contracts with councils for voluntary services to provide volunteers support on site to anybody with additional needs. And we are working very closely with 3 integrated care partnerships across city and the county to enable a very sensitive and localised place-based response to community needs, including some very proactive plans around in-reach into hyperlocal areas. We are stratifying invitations to book in at local vaccination services via our e-health scope methodology, which is linked to general practice, so that we can engage by target populations and that they can be tracked and, where needed, targeted to ensure communities have got improved access. Local performance has identified a number of differences in uptake rates between different areas of deprivation and different Black and minority ethnic groups, particularly Black and South Asian groups with less uptake. Our analysis is therefore designed to look at age, gender, ethnicity, areas of deprivation, PCNs and ICPs, as well as across the whole system and other key vulnerable groups. As a result of some of that analysis, we've established pop-up clinics, and we have also established City and County Council outbound calling through the call services that are delivered through both authorities, targeted communications. We're looking at a mobile vaccine clinic. We're liaising and working with trusted community leaders to engage communities. We've also established community in-reach to try and prompt individual cohorts to attend for a vaccine. We have now a prescribed homelessness approach, which I'd like to think we influenced at a national level, but one of the things we were concerned about was with our homeless community, the second vaccine would be a challenge if people had to wait for 12 weeks. So we're looking to bring forward the second vaccine for some of that community. And we're also considering things like religious festivals such as Ramadan. This work will obviously remain ongoing throughout the course of the programme and beyond. But it's really important that we do it, and it is feeding in intelligence to a number of other opportunities to engage with communities from a health perspective. As I mentioned previously, from a community pharmacy perspective, Chair, Bulwell Riverside stood up from the 13th of March. The Village Hotel Pharmacy to You at Chilwell stood up from the 10th of March, and the Towers Pharmacy has been stood up since February. We're expecting new pharmacies coming online to deliver the vaccine in Newark, Woollerton, Edwinstowe, Nottingham City, Hucknall and Beeston from next week. I'll leave it there, Chair, and take any questions.
That's very good, Sarah. Thank you very much. So, Jonathan, did you want to come in, or do you want me to open it up for questions just on that specific slides?
I can do it in whichever way best serves the committee.
Well, let me ask members then, if you don't mind waiting a few minutes, then Jonathan, while this is still fresh in members' minds. Has any member got any questions or comments to make about Sarah's presentation there, please? Alan, are you indicating, Alan?
I am. It wasn't mentioned in the presentation, but it is an ongoing issue and a new concern about the concerns raised by some European nations about the AstraZeneca vaccine and any impact that may have on vaccine take-up in this country. There's no doubt, and it's mentioned in the report, that the vaccine programme has been fantastically successful, and the NHS should be congratulated for that. But are we anticipating any reticence among people to take the AstraZeneca vaccine as a result of the publicity around the decision taken by some EU nations not to use that vaccine at this point in time? And what provisions are in place to try and combat that?
Okay, thank you. Ben, I'll take your question as well, please, and then I'll go to Sarah.
Thank you, Chair. Just a couple of quick ones. First, just on the spreadsheet, maybe I'm being thick, so please forgive me. It wouldn't be the first time, but I'm a bit confused as to how 106% of the population can have taken the first dose on the form, and I wonder if you could clarify that. And the second thing was just about the kind of roaming housebound teams. I know that the thing that comes across my desk in terms of challenges with the vaccine has been people saying I've tried to find out how for my housebound parent or grandparent or whatever that may be, and there have been delays seemingly in delivering that, and I wonder if there's any update on that as well. Thank you.
Okay, thank you. Sarah?
Yeah, thank you. Thanks, Councillor Rhodes. I think in response to your question, it is probably quite early days, and certainly as far as we're aware, there's no real evidence that the AstraZeneca vaccine is impacting on individuals in that way. However, I do know that the World Health Organization and others are looking into this, and we will get inevitably a national steer on this particular situation. But I would still encourage everybody to uptake the AstraZeneca vaccine. We are looking at trying to put forward some very proactive plans for encouraging people to uptake their second dose vaccine. We would be very disappointed, given the amount of progress that has been made over recent weeks, if people voted with their feet and chose not to because of their fear of the vaccine. I am not picking that up though in communities, and I'd be interested to get some feedback from you as to whether you are more broadly picking that up in your communities, because actually at the moment we're not picking that up. I think most people who've been through their first vaccine are pretty confident in the process, and therefore I'm generally hopeful that what is at the moment, a theory lacking in evidence doesn't impact on the uptake of the second vaccine, but we're very cognizant of it, and we are doing a lot more proactive work to make sure that we've got really good comms and engagement about the benefits of the second vaccine dose. With regard to the other questions, the 106% thing is different measures of population and cohorts of population. So based on what we thought the baseline was, we're at 106%, Ben, but actually there are just two different counting mechanisms. That's why it looks like that, unfortunately. So it is a bit confusing, and you're not the first to ask the question. I'm hoping that can be reconciled at some point, so we get the really genuine full picture of the vaccines received. From a roving housebound perspective, Although Roving Housebound has had some, well, actually the Roving Housebound service is a real success story. It's delivered a huge number of vaccinations into people at home. There are always going to be the odd individuals who are housebound, and for whatever reason we're not aware of them, and despite the fact that we utilise general practice information to support identification of those individuals. I've received a number of individual references around individuals who are housebound who have yet to receive the vaccine. What I've been able to establish for every single one of those is a home-based appointment very, very quickly. So I would encourage you all to please continue to refer those people directly to me, so I can make sure that there is nobody left outstanding from a housebound perspective. So yeah, whilst I do appreciate that there are odd individuals that have yet to receive the vaccine, as soon as we do know about them, we do get the vaccine team out to vaccinate them.
Okay, thank you. So, I mean, I'm not sure if members are aware of what Alan was alluding to. In some countries, and I think Scotland was one of them, there has been some concern that taking the AstraZeneca vaccine might lead to blood clotting. But from the research I looked at and what officers have told me, that appears to be a bit of a red herring. I'm not aware of there being any clinical evidence that that's true or not. Perhaps, Jonathan, you've got something to say on that. And if you haven't, then just move on to your bit.
So the only other comment I would make is to remind members that we're fortunate in this country to have a system where there are millions of people every year benefiting from the protection that vaccines provide, and part of that system, which undergirds that, is the Medicines and Healthcare Product Regulatory Agency. They've got very effective arrangements in place and have had for decades to track and monitor the side effects that might arise from any of these vaccines. That's in place as well for the COVID vaccines, the AstraZeneca vaccine included. It's called the Yellow Card Scheme. So what we can feel very confident about is that we've got a set of vaccines that are effective and are safe, and we've got a really good system in place to keep an eye on that. So I'm very confident in promoting this really strongly to all of our residents. People can feel that very confident to go forward as soon as they become eligible for the vaccine.
Yeah, I think it would be a real pity if this actually derailed the entire programme. And as absolutely. I think you said, sir, I mean, I don't know if other members have picked anything up. I certainly haven't. I mean, the only concerns I've seen have been in medical magazines. I haven't seen any. Nobody from what I would call an ordinary member of the public has never come to me. I don't know about you, Alan.
Chair, I certainly don't want to propagate a scare story, and it's right to say, and Sarah's response was a good response, but it is very early days. This story, I think, broke sometime over the past couple of days. But of course, we know that there are certain groups, have already been referred to in this report, who are reticent about vaccines, some in the BME community and others. The last thing any of us want is for anybody who is already reticent about the vaccine to be seeing this negativity around the AstraZeneca vaccine and using that as a more of an excuse not to do it. So I'm just really concerned about any impact, but I hope, and I know everybody else hopes, that this story will go away, because I'm sure that there's nothing at all to be concerned about. I know many people, including my own wife, that's had the AstraZeneca vaccine and without any ill effects at all. So I'm sure it's a story that will run its course very quickly, hopefully anyway.
Thank you. Ben, did you want to come back?
I just wanted to say, I put in the chat, but I think it's probably worth just saying for the public record that I mean, this will be all over the papers today because it's a story that kind of broke over the last couple of days in the papers. But from the reviews that have been done, there have been 22 cases of blood clots across over 17 million doses of the vaccine that have been delivered. That's a lower proportion than exists within the normal population outside of vaccination. So It seems, without making it political, it seems to be a political issue, frankly, as opposed to a medical one. And that's certainly the advice from most of the major kind of health organisations who are in despair, frankly, at the decisions of these countries to stop using it.
Sarah?
Yeah, I would just finally add, I suppose, I think that's really good evidence that Ben's just presented, and the reality is it does challenge some of the items that have been in the press over the last couple of days. But people are human, so anything you can do to reassure and support people to receive their vaccination would be very much appreciated moving forwards. As I say, irrespective of the validity of the concerns, we are still trying to proactively put something into a place that addresses those concerns to encourage certainly uptake of the second vaccine and first uptake as we move into the younger age cohorts as well. We would not want to see this impact on what has been quite significant and astounding progress over the last 2 months. That has moved us from being very low in terms of Midlands performance to at least in line with the average Midlands performance. So we would want to continue and increase our delivery in that way. So yeah, it's just to mention that and ask for your support with managing that message.
Yeah, I mean, personally, I don't see it being an issue. I've not, as I say, wrong to be patronising about this, but what I would call ordinary members of the public have never brought it up to me, and I'm sure most members would agree with that as well. I take Ben's point that it's probably a political issue somewhere down the line amongst certain countries. Jonathan, do you want to come in then, please?
Certainly, yeah. So what I'll do, Chair, is just to finish off that situation update by referring briefly to the rates that we've got in Nottinghamshire County, the situation that we see in our local health and social care system, and then, if I may, I'll move on to outline to members the work that's gone on to refresh the local outbreak management plan. And if I may, I'm going to start off by using a couple of slides to keep me on track as we go. So I'm hoping, Chair, that you can see on your screen now a chart which sets out the case rate in Nottinghamshire County over the last several weeks, not the period 4th to the 10th of March, as it says in the title, but actually over the last 3 weeks or so leading up to the 10th of March. The grey line in the middle is the one which tracks this for all ages. And you'll be able to see that if we go back a week or 10 days now, or a week or so, the rates were falling in Nottinghamshire County really very fast. Over the last 4 or 5 days, those have that's slowed up somewhat and has flattened off. So the rate that we have in Nottinghamshire County as a whole at the moment now stands at 81.5 per 100,000, and that compares with an East Midlands rate of 82.3. So we're just lower than the East Midlands average. We're still higher than England average, which stands at 58.7. And within the county, we still see quite a lot of variation. And on the next chart, you'll be able to pick that out in the 4th column from the right-hand side, where we've got these numbers in white against a red background. I think you'll be able to make out that whereas in Broxtowe, which has the lowest rate, we see just a rate of 54.4. In Bassetlaw, which has the highest rate at the moment, it stands at 127.7 per 100,000, and in fact has gone up slightly over the most recent 7 days for which we're tracking this, and it perhaps warrants just a little bit of comment about what we see going on in Bassetlaw, if I may, Chair.
Yeah.
So we have seen in Bassetlaw an increase in all ages, so working age people, but particularly amongst over 60s. Where we've been working with a care home, St Saviour's Care Home, on an outbreak that we've seen there, and over the last week, where we've got most complete data, we've had 20 cases there, and we can see a handful more cases coming through over the next few days. Most of those residents and staff have been asymptomatic. And I can also confirm to you that care home all but one of the residents were vaccinated on the 11th of January, and I think I'm right in saying the one resident who declined at that point subsequently accepted chose to take up the offer of vaccination. It's something we need to continue to watch, but in general, most people in that care home are not experiencing the level of sickness and hospitalisation which we would have seen were this happening 3 or 4 months ago. And that is, as far as we can tell, the positive impact of the vaccination. It's very difficult to tie what is going on in Bassetlaw down to any single setting. We see, as we have over recent months, some clustering around residential addresses, which indicates some household transmission. That's in common with the rest of Nottinghamshire County. We're also taking a close look at occupational exposures, which are higher than the regional average. And again, that is consistent with what we've seen in other parts of Nottinghamshire over recent months, because we have a demographic where more people than on average across the Midlands are needing to go out to work, many of them in sectors including warehouse distribution, manufacturing and construction. So the picture in Bassetlaw continues to reflect that. We are working with several workplaces that they'll be known to members, that includes distribution centres connected with large companies in the Bassetlaw area, food producers and others. I can let you know that the outbreak that we saw at HMP Ramby going back a month or so ago, the numbers there now are very low. And also, by way of context, I just note that across the border into Yorkshire, we do see high rates as well in Rotherham and Doncaster as well. So that's a bit of information around Bassetlaw, and we will, of course, keep members informed if there's anything more specific that arises. I will just mention in connection with Newark and Sherwood that we can see that we're, over the next few days, going to receive confirmation of some cases which I think will nudge rates in Newark and Sherwood higher as well. So although if we track back a month or so, the situation we've got now is much more encouraging. We're not out of the woods yet. That's a rather overused cliche, but there's further work to do, and we need to continue the good work that residents, businesses and others have put into bringing rates down. I'll comment briefly then on the situation in our local NHS, where we see admissions and COVID bed occupancy continuing to reduce, and they're now stand at levels which we've not seen since last October. So that's an encouraging picture, and our local hospitals also are reporting that absence due to coronavirus amongst hospital staff is much improved. It's as low as 2.5–3% now. But we should note that many hospital staff are very fatigued. And I think the same will also be true of staff right across social care, including our care home sector, where the picture is also easing. We have a reduced number of outbreaks compared with a month or so ago. Those outbreaks now tend to, in care homes, tend to more involve people who do not have symptoms. So a much better picture than we were seeing a few weeks ago. If you're happy, Chair, I'll move on to talk about the refresh of the local outbreak management plan, and I'll do that by way of just 2 or 3 more slides to summarise that to you. If members cast their minds back to last summer, May-June time, local authorities were instructed that they needed to produce local outbreak plans, and that was to be the local complement to the national response to COVID-19. So nationally at that time, there was a lot of focus around setting up testing and tracing facilities, and also to set up infrastructure which would make sure that at national level we had a really good evidence base on which to take decisions. And then the local complement to this was what's highlighted in red there. This was the arrangements to ensure that we were able to identify outbreaks really quickly and then take the necessary measures to contain those outbreaks. So the local outbreak control plan that we produced 9 or 10 months ago was really about dealing with those local flare-ups. and really set out the arrangements to stand up and to mobilise a response locally. It was shaped at that time by guidance which was published in the National Contain Framework. And since that time, the arrangements we've had in place have been assured by NHS Test and Trace's regional team in their Contain division. That plan built very much on Nottinghamshire's existing LRF partnership arrangement. So we were already building on a strong foundation. We published that as a document so that that was available to residents, and the plan itself centred on those 7 themes which we were required to address. Latterly then, in the last 3 weeks or so, we've been instructed to ensure that the outbreak management plan is refreshed. I won't read out everything on here. You can see it for yourselves. But amongst the things which we needed to focus on are really the end-to-end response function. So that's all the preventative measures that we've got in place, the daily surveillance that we undertake, as well as the testing that committees heard about before, the ongoing arrangements around outbreak management, and so on. And over on the right-hand side, there are 2 or 3 things there to draw to your attention that newly find their way into the plan. So the plan now makes reference to or links through to the LRF plan we have to undertake surge testing if a variant of concern is identified in Nottinghamshire. We've not received any signal about that so far, so we haven't yet had to stand that up. We'll also, in the plan, we also address some of the action needed around enduring transmission. So we are in the Midlands generally finding it harder to drive down the rates. We're finding that harder than in some other parts of the country. So that's something we're starting to look at as well. Also, some other areas where we can do further work. So enhanced contact tracing. This is building on the good work and the good performance that we already have locally, but just looking to how we can improve that in the period ahead. And of course, also making sure that our local arrangements over the medium term now interface really well with arrangements for the rollout of the vaccine in this phase and indeed in subsequent phases too. So finally then, just to draw your attention to the fact that the refresh plan that we submitted on Friday evening, it's still pretty high level. We are still awaiting from Department of Health and Social Care the updated National Contain Framework and also an outbreak management response toolkit. And when we take receipt of these in due course, it may be that we need to make further adjustments and tweaks to our local plan. We will be undertaking further engagement with LRF partners because the very strong support we've had from our districts, our boroughs, from agencies like Notts Police, Nottinghamshire Fire and Rescue is going to be really important in the period ahead as well. And the short timescales in which we've had to complete the refresh haven't allowed us to complete that engagement yet. And then finally, the plan identifies not only the good arrangements we got in place, but some areas where we need to do further work. And the priorities for that, I think, really will be about exercising the new plan that I mentioned around surge testing. We want to do some further work to strengthen what we do around contact tracing, and we're working with the regional team and with neighbouring local authorities around that. We'll also continue to work on expanding community testing sites, and that's so that we can play our part full in Nottinghamshire to support the national ambition around asymptomatic testing. And then finally, and this is something which I think with your agreement, Chair, I perhaps need to come back to in future months, we need to put in place within Nottinghamshire arrangements to sustain a response capability for what I think will be the next couple of years or so. And that means strengthening and potentially replacing some of the staff who are currently involved in it, because they will need to return to their business as usual activities. So I need to give some further attention to that in the coming months. That concludes what I was planning to cover. So it's back to you, Chair.
Thank you very much. I'm sure members have got questions. Just, I was having a conversation with one of the officers earlier. Just explain to me, this is particularly relevant in terms of the outbreaks in care homes. My understanding is that if you have the vaccine, that doesn't make you immune from getting COVID. It's 70 to 80%, I think, that you're less likely to get it. But the important thing in terms of care homes is that if you do get it, it's less virulent and it's less likely to send you to hospital and spread as quickly. Is that true? So if you have the vaccine, even if you catch it, it's less likely to hospitalise you. Is that the case?
Chair, you're quite right. The vaccines have in the trials that were undertaken were really focusing on how making sure that they were effective at reducing serious disease, hospitalisation, and death. And we are seeing those reductions. So the vaccines are having their intended impact. There's the second thing, though, is really around transmission, around whether or not they're going to turn out to be effective at reducing the spread of the virus. And you also touched on that. Now, there are some very promising signs that they are and will dent the spread of the virus as well. But the evidence on that is still coming together. So although I think we've got grounds to be optimistic, we probably need to wait a little bit longer before we can say with absolute confidence that it's having the intended effect there.
Fair enough, Jonathan. Joyce, sorry.
Chairman, you didn't do the recommendations.
I've not finished asking. Joyce has got a question, Reg.
Oh.
Yeah, yeah. Thank you, Chair. I've got a couple of questions. Well, actually, 3 questions now. On your last point, Jonathan, about sustaining COVID for the next 2 years, I think that's really important because I must admit, and I am slightly anxious that as we start to relaxation the lockdown rules, we need to be sure that, like, we've got the schools going back, and as we start to relax, we need to make sure that we're on top of it and keeping a track of what is actually happening. So I'm quite pleased to see that ongoing work. Secondly, and it's related to it, I suppose, is since we started talking about this plan to come out of COVID, I've noticed an increase in the behaviour, the unsafe behaviour of communities. And I'm talking about seeing people going in and out of people's houses thinking it's okay to do so. And it's quite noticeable in shops as well. So I'm particularly anxious about that. And I wonder whether you've picked up on anything about changes to behaviour when you meet with, as a LRF, when you're meeting with partners, and whether they're starting to be aware of this. I'm thinking obviously about the police. And then secondly, and perhaps more importantly, is around, and I could mention this in the next item, but I might as well talk about it now. And it's the reluctance of some of our own staff to have the vaccine. And what are we doing about that? And what are we doing about care homes where there's care workers who are reluctant to have the vaccine? I know it's a national issue and it's a very awkward issue, but I'd like to know exactly where we stand on that. I'm hoping that health is starting to give that some serious consideration, where we have nurses who are reluctant to take up the vaccine, but I'd like to know exactly what we're doing in Nottinghamshire as well. Thank you.
Thanks, Joyce.
Do you want me to come in, Chair?
Yeah, please. Yeah, please.
So yes, I can confirm, Councillor, we will continue to have in place and run with the surveillance arrangements and the rapid response arrangements, which allow us to quickly identify where there are outbreaks and to deal with them. As the rates come down and we move from a situation where there's general community transmission, and we, as I hope, return more to a situation more like what we saw last summer, I think we'll be back into a situation where we'll be much better placed to quickly identify those flare-ups and deal with them. In terms of the feedback we get from LRF partners, yes, there are LRF partners who also report that as well as many people continuing to behave very responsibly and doing their bit, we do hear some reports of people who are wanting to take shortcuts on the roadmap that we have been set out for us. And yeah, and it is important to remember that at the moment we are still in step one. That does mean that we're allowed to leave home for recreation and exercise outdoors with our household, with our support bubble, or with one person from another household. As the weather warms up and we're so desperate to reconnect, it's very understandable that people want to mix more widely. It also remains important that we only move forward with this and relax measures at the pace that the Prime Minister has set out for us. The reason for that is, as we open up schools and the economy, which is absolutely the right thing to do, that will inevitably place some pressure, upward pressure, on rates and on R. So while that happens, it's all the more important that all of the rest of us continue to follow all of the measures, the proper measures that are in place. And then finally, you commented about staff hesitancy in terms of vaccine uptake. And as you did that, I was scrabbling around on my desk for the numbers, which I've now found. I can tell you that in our care homes in Nottinghamshire County, more than 80% of staff and residents have already been vaccinated. That figure does vary somewhat from home to home. For example, there are some homes where there were outbreaks and the vaccination had to be delayed in order for a time to elapse before that could be undertaken. So there's further work to do, but actually in Nottinghamshire County, we're pretty compared to other areas, we are doing well. More than 70% of social care staff at the last update that I was given had already received the vaccine, and I'm really pleased to say that that amongst unpaid carers, 72% have taken up the offer as well. Now, there's further work that we can do. I think it's to be applauded when people ask questions. I, along with others, will encourage people just to remember that there is a lot of false information circulating, and some of that can produce a very strong reaction in us. And so I would really be urging people, if they hear information which is of concern to them, to check out the source of that information before they act on it. A lot of it comes from a mate who received it from a mate who received it from a friend, and so on. So it's really important, check out the source of the information. There will be other things that we can do to follow up with staff who thus far haven't taken up the offer of a vaccine, and of course we're pleased to engage in one-to-one conversations to check with members of staff whether there's any other information or any other support they feel they might require.
Thank you.
Thanks, Joyce. Reg was quite correct, actually. I should have formally moved the recommendations before I opened it up to questions. So I'll formally do that now. But I see, has anybody else got any questions before I move to the vote? Sarah, beg your pardon, did you want to add anything, Sarah?
It's not a question, just a comment on what Jonathan's been referring to in terms of the work that's happening with health and care workforce to try and encourage them to engage with the vaccination programme. And it was probably about 3 weeks ago now, 2 weeks ago, we opened up all of the sites in the community, all of the local vaccination services, so that actually any health or social care worker can walk in without an appointment. And that's because we got some feedback that some of our domiciliary and community workers were struggling from a shift perspective and not being able to plan forward. So all of those workers can now attend the vaccination sites and walk in and receive their first vaccination. They'll be given a follow-up appointment for 12 weeks later. So just to assure people that there is a lot of work that's happening to try and encourage that uptake.
Yeah, that's a really good idea. Yeah, well done with that. Kay?
Thank you, Chairman. There's two things. I share Joyce's concern about people going into care homes who haven't been vaccinated. And as we come down the cohorts, I understand we're in cohort 9 at the moment, that's 50 plus. I would have expected all care workers to seriously consider being vaccinated, because we do have a duty of care to people who live in those homes. And they are living there, that is their home. And if they are being exposed to disease because someone's reluctance to have it, then I think we need to think quite seriously about how that's operating. And I know we don't have any care homes that belong to the county council. These are all private care homes. But if it were my relative in a care home, I'd be very concerned if they weren't making quite sure that everyone who dealt with my beloved person wasn't vaccinated. And I do think we're now going to have quite a strong view of this. If they're not going to be prepared to be vaccinated, they probably can't deliver services which are close personal services, because that wouldn't be fair to the person they're looking after. Thank you.
I agree.
Thank you, Kate. So I can't see any more hands raised. So unless anybody wants to ask any more questions or make any more comments, I'm going to move to the vote. So as per normal, we're going to have a roll call for the vote. So Joe, would you like to? Reg, did you second them? I beg your pardon.
You never asked me to.
Oh, sorry. I'm asking you now, Reg. Sorry.
You didn't do the recommendations.
I know, Reg. I'm like a lapdog.
You're getting carried away with your vaccinations.
I was. I beg your pardon. I have formally moved them. I thought I had, actually. I beg your pardon. So I'm formally moving them on page 7. I'm asking for somebody to second them.
I'll second those and reserve a right. Thank you. We can go to the vote now.
Okay. Thanks a lot. Okay. So that was my mistake. I beg your pardon. Joe, would you like to do the roll call, please?
Brilliant. Thank you very much. And just to confirm that today, while we'll be taking the vote by roll call, these won't be recorded votes in the minutes unless 2 or more members of the committee request it, in line with the council's usual recorded vote procedures. So Councillor Adair.
4.
And Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Wonderful. Thank you very much. That is carried unanimously.
Thank you very much, members. So we're on to number 5 now, which is the update report. So I'm going to hand this over to Derek. Derek, and I think Adrian is going to chip in as well. So Derek, would you like to introduce this report, please?
Thank you, Chair, and good morning, members. Members, you'll be familiar by now with the format and general content of this report, which, as ever, summarises the broad response of the County Council to the COVID pandemic, both from a departmental perspective and also across a number of thematic and particular issue areas as well. You'll see that over time the report has got increasingly comprehensive, and I think that reflects the volume of activity that the County Council and our officers have engaged in over recent months. And you'll see that as well as covering broad issues that impact upon both the council services and those of our close associates like schools, we also cover off a range of our internal issues around things like workforce and our financial response as well. In the light of the conversations that we've had thus far in the meeting this morning, I'd also want to draw members' particular attention to paragraph 58 of the report, which sets out our intention to bring a fuller response to the recovery issues posed by the pandemic to a future meeting of the committee within the context of an overarching recovery framework that we're currently working within the council to pull together, and that will enable us to set out for members the steps that we'll need to take to continue to respond to the pandemic through the remainder of 2021. So it will offer a glimpse to the medium term from the County Council's perspective as well, and what we're intending to do to best secure services and support local residents. And as I say, that will be brought before this committee or the appropriate committee at the next available opportunity. I'll leave things there. Happy to take any questions or comments that members might have.
Okay, so let me try and get this right this time. I'll formally move the recommendations which are included on page 24 of the agenda pack. Do I have a seconder, please?
I second that and reserve the right.
Okay, thank you, Reg. Now, does anybody have any questions or comments to make on Derek's comments there? No?
No.
Looking good, Derek. Thank you. Obviously, to be up to the new administration, whatever persuasion or colour it is, to decide on how they take this forward. But Adrian, is there anything you need to add before I move it on to the vote? No. Are members happy with that then? Because I will move it on to the formal vote if not. Thank you very much. So, Joe, would you like to take the roll call again then?
Thank you. Councillor Adair.
4.
Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That's also carried unanimously.
Can I thank you, members? And we've only got the work programme, and as I said, you know, there's nothing really to say about that at this juncture. This is the last formal meeting. It'll be up to whoever takes over to decide whether they want the committee, and if they do, what the work programme will be. So I can only thank you for your year's work, and good luck to all of you. Thank you very much. And with that, I'm going to close the meeting. Thank you.
Thank you.
Cheers.
Thank you, Chairman.
Cheers, everybody.
Thank you, Chairman.
The Prime Minister's roadmap to recovery holds out the prospect that we can return to so many of the freedoms we've been missing, and that by summer and autumn we could be enjoying for ourselves again, getting together with friends and family. All of us are looking forward to that. But between now and then, we actually have quite a long way to go. And the reason for that is that the rates at the moment in Nottinghamshire County are still running at a very high level. It's really important that we bring those rates much lower. To continue with rates at this level, we risk seeing a resurgence which would threaten our local NHS, and it's imperative that we avoid that. So I'm urging everybody, right from the start of this roadmap as we move into step 1, to continue to do all you can to pay attention and to follow all of the rules that are in place in step 1. It's really critical that we don't race ahead to a next step without completing this one. To do that would risk the recovery that we're all looking for.